Good morning, I'm Fanni Meznerics, and I would like to present to you the topic of my PhD, which is the investigation of the efficacy of platelet plasma treatment in chronic dermatological disorders. I'm a PhD student at the Department of Dermatology, Venerology, and Dermatooncology, and my vision is that patients with chronic dermatological disorders could have a better quality of life. And I would like to achieve that by finding new topical therapeutic options for these chronic dermatological disorders. Here you can see my specific goals. The first two projects are related to platelet-rich plasma treatment. The first one is about the treatment of alopecia areata, and the second one is about chronic wound management. And I have an additional third project about rheumatoid arthritis and the monitoring of rheumatoid arthritis with the multi-biomarker disease activity score. So about my first project. Alopecia areata is an autoimmune condition where we can see inflammation-induced, usually patchy hair loss. It can affect the scalp, the beard, or even the whole body, leading to a serious deterioration in patients' quality of life. The lifetime incidence risk of alopecia areata is estimated at 2.1%. And regarding the treatment options, triamcinolone acetonide is the first line of treatment in localized alopecia areata. It is an intraregionally administered corticosteroid, so given it's a corticosteroid, there are some concerns with this treatment modality. One of them is adverse effects, and the other one is steroid phobia. So when one of these problems occur, platelet-rich plasma can be a great alternative. It is a relatively new treatment modality in the field of dermatology. It contains concentrated growth factors and cytokines which can promote hair regrowth, so it is already used in the treatment of androgenic alopecia, which is a different subtype of alopecia. So our aim was to evaluate the effects of platelet-rich plasma on hair regrowth in alopecia areata. The clinical question was, does platelet-rich plasma increase hair regrowth in alopecia areata compared to triamcinolone acetonide? The population was patients diagnosed with alopecia areata of the scalp. The intervention was platelet-rich plasma treatment. The comparator was triamcinolone acetonide, both injected to the scalp. And the outcome was hair regrowth, estimated with the help of the SALT score, which is Severity of Alopecia Tool score. SALT score shows us the percentage of hair loss affecting the scalp, so that the greater the decrease in SALT score is, the better the improvement of the disease. And our hypothesis was that PRP is as good as triamcinolone acetonide in the treatment of alopecia areata. Here you can see some information about our search and selection process, and also our results regarding the decrease in SALT score, both in PRP and triamcinolone acetonide groups. And we can see that we could not detect a clinically significant difference between the two groups, and also could not detect a statistically significant difference between the two groups. So platelet-rich plasma can be a promising treatment modality in alopecia areata. Given it's a steroid-free treatment modality, it can be used an unlimited number of treatment sessions without the increasing risk of adverse events, unlike in case of steroids. And it can also be an alternative in case of steroid phobia. However, further high-quality RCTs are needed to better assess the efficacy and strengthen the quality of evidence with longer follow-up periods where you can see further differences between the two treatment modalities and potential beneficial effects of PRP treatment, and also with different ways of administration of platelet-rich plasma, like after microneedling or after laser treatment. The PRP can be applied as well in a less invasive way. And here's the status of my first manuscript. It has been accepted in July. And the second project is about chronic wound management with the help of platelet-rich plasma. Chronic wounds are common medical conditions and have a high impact on the aging population. The cost of wound management is estimated to account for 5.5% of all healthcare expenditures, and chronic wounds can also lead to a serious deterioration in patients' quality of life. The standard treatment is smart dressings and compression, but the special bandages which are used are not the only thing which are making the ulcer management so expensive, but also the human resources, because the recovery time is really long. So if there's an additional treatment modality which can shorten this recovery time, it's not only good for the patient's quality of life, but can also be beneficial for the healthcare system. So platelet-rich plasma could be this add-on treatment modality. It can not only promote hair regrowth due to the concentrated growth factors and cytokines, but can also promote tissue repair and regeneration. So our aim was to evaluate the effects of PRP on wound healing in chronic wounds. The population was patients diagnosed with chronic wounds. The intervention, PRP in addition to conventional ulcer therapy, and the comparator was conventional ulcer therapy alone. And our primary outcome was the change of wound size, while secondary outcomes included healing time, infection, pain, amputation rates, and adverse event rates. And our hypothesis was that additional treatment with PRP is superior to conventional ulcer therapy alone. And here's the data about the search and selection process, and the results regarding the complete closure. And we can see here that the odds for complete closure were five times higher in the platelet-rich plasma group and than in the than in the conventional treatment group. And the difference between the two groups was statistically significant. So platelet-rich plasma can be a great, safe, well-tolerable add-on treatment modality in chronic wound management, which can shorten the recovery time and improve patients' quality of life, while also can be beneficial for the healthcare system. And here's the status of our second manuscript. It has been accepted just 2 days ago. And the third project is about the monitoring of rheumatoid arthritis with the help of the multi-biomarker disease activity score. Rheumatoid arthritis is a chronic autoinflammatory disease with a prevalence of 0.5%. And the intensive monitoring of the disease activity is crucial for the treat-to-target therapeutic approach. However, there are mainly subjective and non-specific monitoring parameters at hand, like DAS28-CRP and ESR. So multi-biomarker disease activity score, which is an algorithm based on the serum level of 12 biomarkers, can be a great objective disease monitoring system, as it does not contain the results of the subjective assessment of disease activity. So our aim was to determine the correlation of MBDA score with the conventional disease activity measures, and also the predictive and discriminative value of MBDA score for radiographic progression, therapy response, and remission and relapse. We had several clinical questions with several PECOs, and I would like to present the one regarding the correlations of MBDA score with conventional disease activity measures. And our hypothesis was that MBDA score correlates with conventional disease activity measures. And here's the data about our search and selection process, and the results regarding the correlations of MBDA score with the two most commonly used conventional disease activity measures, subjective conventional disease activity measures, DAS28-CRP and DAS28-ESR. And we can see low to moderate correlations between these three disease activity measures. And I would like to highlight that as MBDA score was designed to complement and not supplant the currently used disease activity measures, its deviation from the currently used disease activity measures is not only accepted, but can even be advantageous. So MBDA score can be a great objective parameter for monitoring disease activity and to supplant the currently used disease activity measures. And here's the status of our third manuscript. It's currently at revision at Rheumatology, Oxford. And here's the summary of my 3 projects. And I would like to thank you for your attention, and I'm happy to answer your questions if you have any.
Congratulations for your work. My question is regarding your second project. We could see that the PRP effect is very high on the therapy of ulcus. How often, my question is, how often used in the clinical practice, or is it often used or not? If it's not, what's the reason?
Thank you for your question. So you mean generally in the clinical practice, how often PRP is used, or how often was it applied for the wounds? The second one. Yes, so there's, thank you. So there are some differences between the studies, but most of the time they applied it once a week or 2 times a week when they changed the dressings. Oh, sorry, so the first question, okay. Yes, so worldwide, I think it differs really from country to country. That's what you mean?
Thanks for the great presentation. My question is about your third topic. You know, associations can be measured in many different ways. Were there any alternatives to simple Pearson correlation which you showed?
The studies use different kinds of correlations, Spearman's correlations and Pearson's correlations. That's why we pulled the data regarding the Spearman's correlations, because we only had enough eligible data for that. Yes.
Maybe you mentioned in your presentation, but I missed it. So concerning the therapeutic use of platelet-rich plasma, I suppose that the origin of this drug in that case is donor blood.
No, it's autologous.
Autologous, so,
yes.
so the patient's organ.
Yes.
Thank you.
Thank you.
Congratulations on your project. I have one question, maybe I misheard, so I just want to hear this information one more time. Regarding the second project, you also were curious about the healing time. So I would like to hear if the healing time was better in the group of platelet-rich plasma. Thank you.
Thank you for your question. Yes, in our secondary outcomes, we included healing time. We could not conduct quantitative analysis regarding that outcome because the results of the studies were really heterogeneous. But if we look at the studies separately, almost all studies reported a faster healing time in the platelet-rich plasma group, and we included these in the systematic review part of our publication.
Yeah, and the very last and very short. I mean, now you have 2 papers accepted, the third one is very close. So what is next?
Thank you for your question. We are planning a clinical trial at the moment, but it's really preliminary. So.